My name is Dr. Kristen Higgins, and I'm a thoracic radiation oncologist at Winship Cancer Institute of Emory University. For thoracic radiation, the most significant side effect is something called esophagitis. And what that is inflammation of your esophagus. And it typically happens about midway through the radiation treatment course. And it can sort of feel like heartburn in your chest or chest pain, a lump in your throat when you swallow. And it can sometimes interfere with eating. But there are a lot of effective medicines that we can give patients while they're getting radiation to make this something that they can get through relatively easily. But particularly for the longer courses of thoracic radiation, let's say 6 weeks, esophagitis is going to be really the most prominent side effect that a patient would experience during the radiation treatment. Now, when it comes to brain radiation, really the overwhelming side effect during treatment is fatigue. It's much more pronounced when you get radiation to your brain, especially whole brain radiation. Fatigue is the most significant side effect. In terms of long-term side effects from radiation are really different than the side effects of radiation during the treatment course. So for thoracic radiation in the long term, side effects can include cardiac events like things such as MIs, accelerated atherosclerosis of the coronary arteries, things like that. So we have to really watch out for cardiac events after thoracic radiation. And that's really mainly when you have those longer 6 weeks courses of radiation that we give for stage 3 non-small cell lung cancer. Now for the brain radiation, the late side effect that we worry about is something called radiation necrosis. And that's when part of the brain, the cells that receive radiation actually die and develop necrosis. And we see that on an MRI, and many times it doesn't cause any symptoms in patients. It's just an incidental finding on imaging. But sometimes it can cause symptoms, things like headaches, and sometimes we have to treat that side effect with steroids in the long term. And I would say those are probably the most dominant side effects for both thoracic radiation and brain radiation. And then in terms of why does radiation cause fatigue, that's a really good question. It's one that actually we don't have a strong answer on. It's an active area of research. I will tell you there are mounting studies that show that inflammation is one of the driving factors that causes fatigue, and that if you look at the blood markers of inflammation, things like C-reactive protein and IL-6, those markers do correlate with fatigue that is measured with a validated instrument in a multitude of studies. So I think there's more literature that's really trying to tease out what are the mechanisms of fatigue, but right now it's really not something that's clearly defined.